Okay. Hi, my name is Mercedes Harbert. Today I will be your student nurse. Today I will be inserting your NG tube. I'll start by checking your identification. Could you give me your name and date of birth, please? And I'll check that against your armband. Next, I'll provide us with some privacy and practice hand hygiene. Okay. I'm going to start by placing you in high Fowler's position. I'll place this linen cloth against your chest. Now could you please close one nostril and blow for me? Could you do that with the other? And the nostril with the best airflow is the one I'll be using, so I will be using your right one. I'm going to start by applying gloves. Now I will measure from your nose to your ear to your xiphoid process and mark it with tape. I'll coil the distal end of the NG tube. And apply lubrication. I forgot to apply the 6 milliliters to the NG tube. Okay. And I will give you a basin and a cup of water to hold. Thank you. Now I will begin by inserting your NG tube. Could you tilt your head back for me, please? Okay. I will begin inserting upwards. Could you please tilt your head downwards for me, please? Swallow. 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 Okay, I have met resistance, and because I'm practicing on a dummy, I will stop here. However, if this was a real person, I would try it again. I would check the back of the throat for coiling. I would remove the NG tube, and then I would try again. If I met resistance once more, then I would seek a physician. For now, I'm going to attach the NG tube to your cheek. Next. Okay. Now that the NG tube is placed, could you speak for me, please? I will check the back for coiling. Okay, there's no coiling. Next, I will take 60 milliliters of gastric content. And I will test the gastric content on a strip of pH paper. Gastric content is supposed to be 5.5 or below. Yours reads 4.3, so that is fine. Now I can better fasten your NG tube on your nose. I will remove the temporary tape from your cheek. And I'll anchor it on there. Okay. And I'll wrap it around there so it's nice and tight. I will also fasten it to your hospital gown. Okay. Now we'll remove and discard of the equipment. I will place you at a 30-degree position. Okay. I will leave the call light with you. Okay. And if you need me for anything, you can press the call light and I'll be there. Now I will remove my gloves. And for documentation purposes, I will document which nair was used, which was the right nair. I will document the number of attempts. I will document patient tolerance, the pH, the size used, and whether the NG tube was for feeding, clamp, or suction. And I will order a X-ray by the physician to make sure that the NG tube is in the correct position. Hello, my name is Mercedes Harbert. Today I will be your student nurse and I will be discontinuing your NG tube. First, I will start by getting your name and date of birth and checking that against your armband, and that looks correct. Next, I will provide us with some privacy, and I will do hand hygiene before I get started. Okay, and I will start by discontinuing your NG tube, and I will apply gloves. I will place a linen cloth. And I'll make sure the NG tube is clamped off. Okay. Now I will remove your nose tape. Next, I will have a Kleenex in my non-dominant hand by your nose. And could you hold your breath for me, please? And in one motion, I will remove the NG tube and wrap the end portion of the NG tube in the in the NG tube, I'm sorry. I'll remove it from your cam. And I will dispose of this in the red biohazard bag. Okay. Now would you like a warm washcloth to assist in hygiene? I'll clean you off, remove equipment, and I'll put you back in a 30-degree position. I'll place the call light here for you. And for I will remove my gloves. I'll practice hand hygiene. And for documentation purposes, I will note the patient's tolerance. I will auscultate for vowel sounds. I will make sure that the NG tube was removed and all parts are intact.